Transversus Thoracic Plane Block for sternal pain control in cardiac surgery and surgery of the anterior chest. My name is Gabor. As terminology of parasternal blocks can be confusing and mixed up with the TTP block, we need to go into more details to get a better understanding. Many terms are described in literature for regional anesthesia techniques for sternal pain control. These blocks differ in extension of analgesia, but they all target the anterior branches of the intercostal nerves. The various terms listed up here on the slide all concern anesthetic blocks around the parasternal region. First, the parasternal intercostal nerve block. The parasternal intercostal nerve block was first described by McDonald and co-workers in 2005 and targets the anterior intercostal nerves just lateral to the sternum as shown on the slide. We will now look at a sagittal parasternal cross-section to understand the parasternal intercostal nerve block, which we will call pin block during this presentation. Local anesthetics is injected into the plane between the pectoral major and the internal intercostal muscles. Literature also describes the pecto-intercostal facial block, also called parasternal pectoral block. In some papers, this block is also named subpectoral interfacial block. To understand these terms, we have to go back to the origin. The parasternal pectoral block was first described in 2014 by De La Torre and co-workers as the ultrasound-guided pecto-intercostal facial block. Injection takes place 2 centimeters lateral to the sternum, as shown here, between the pectoral major muscle and the intercostal muscle. Let's look at it closer with a sagittal cross-section view at 2 centimeters lateral to the sternum. The sagittal cross-section view at about 2 centimeters to the lateral border of the sternum shows again the following structures: the pectoralis major muscle, the internal intercostal muscle, the transversus thoracic muscle, with underneath the pleura. In order to perform a parasternal pectoral block, local anesthesia is injected between the pectoralis major muscle and the internal intercostal muscle, as shown here on the slide. As a reminder, costal cartilage is displayed as a black shadow in ultrasound imaging. This is a cartoon of an ultrasound image of the same sagittal cross-section view where local anesthesia is injected between the pectoralis major muscle and the internal intercostal muscle. In 2016, Razor and co-workers first described the term subpectoral interfacial plane block, also called parasternal pectoral block, for pain management in sternal fractures. However, in 2017, Ushima H. and colleagues concluded that the plane for local anesthetic injection is the same for the subpectoral interfacial block as for the parasternal intercostal nerve block. On this figure of a parasternal intercostal block, the plane for the local anesthetic injection is located between the pectoralis major muscle and the intercostal muscle. So at the same plane for injection as for the subpectoral interfacial block, also called pecto-intercostal facial block or parasternal pectoral block. This proves that the conclusion of Ushima and colleagues is right, namely that the plane for the local anesthetic injection is the same for the parasternal intercostal nerve block as for the subpectoral interfacial block. So, to come back clarifying the different terms described in literature for the same blocks, we can conclude that the pecto-intercostal facial block is the same as the parasternal pectoral block, also named subpectoral interfacial block. As for the parasternal intercostal nerve block, in all these blocks, local anesthetics is injected into the plane between the pectoralis major muscle and the intercostal muscles. So for simplicity, let's call all the discussed blocks, which are displayed on the slide, parasternal intercostal nerve blocks, or simply pin blocks, where the plane of local anesthetic injection is located between the pectoralis major and the intercostal muscle. Finally, we come now to the subject of this presentation, the transversus thoracic plane block, which is also called transversus thoracic muscle plane block or parasternal plane block. For simplicity from now on, let's use the term TTP block. As a reminder, TTP block is in contrast to the previously described parasternal intercostal nerve blocks or pin blocks, where local anesthetics are injected between the pectoralis major and the internal intercostal muscle. The transversus thoracic plane block was first described by Ushima and Kitamura in 2015. How does this new regional block clinically differ from the pin blocks? Both types of blocks carry risks of vascular rupture. A pin block needs multiple injections, while the TTP block only needs one single injection of 15 to 20 mL of local anesthetics to block T2 to T6 dermatomes. However, the TTP block is performed deeper than the pin block and carries the additional risk of pleural puncture. And finally, there is a difference of the spread of local anesthesia. We have a look again on a sagittal cross-section view at about 2 cm lateral from the sternum, in order to understand the different spread between the pin block and the TTP block. As we can see here, the intercostal nerve is confined in a space between two ribs. In case of a pin block, local anesthetic spread will most likely to be limited in the confined space between the two ribs, while in a transversus thoracic plane block, the spread of local anesthesia will involve several dermatomes. In this slide, the transversus thoracic muscle is in green, and the internal intercostal muscle is in red. The internal thoracic vessels are running anterior to the transversus thoracic muscle but posterior to the ribs. As it has been mentioned before, for pin blocks, to achieve analgesia in a large area over the anterior chest, multiple injections are needed into several intercostal spaces. While in contrast with TTP block, one injection only will cover several intercostal spaces to provide analgesia to the anterior chest. As seen here on the slide, in a TTP block, the spread of local anesthetics is between the internal intercostal muscle and the transversus thoracic muscle, lateral along the sternum. So back to the sagittal cross-section view at about 2 cm lateral from the sternum, which summarizes on this cartoon the different spreads of local anesthesia in a pin block compared to the transversus thoracic plane block. We will leave the sagittal cross-section view and look at the local anesthetic spread in a transverse cross-section view. Leaving the transverse cross-section and going back to the sagittal parasternal cross-section view, we can see the spread of local anesthesia in a TTP block. For the same cross-section, this ultrasound reel image shows the injection of local anesthesia into the transversus thoracic plane, with a spread of local anesthesia between the internal intercostal muscle and the transversus thoracic muscle.